Welcome to the FRAS Focus Regional Anesthesia series. I am Dr. Gopal Krishan Jalwal. So in this video I am going to demonstrate you how to perform the PEC1 and PEC2 block. So PEC1 and PEC2 block. So indications of PEC1 PEC2 blocks are brace surgery and lipoma over the chest. Patient should be placed in a supine position to perform the PEC1 and PEC2 block, and usually we use the high frequency linear probe, and the local anesthetic those are commonly used are bupivacaine 0.25%, levobupivacaine 0.25%, ropin 0.25%, and the volume that is given is 10 ml in the PEC1 block and 20 ml in the PEC2 block. So echogenic 100 ml needle, peripheral nerve block needle is suitable to perform the block, and through the PEC1 block we target the medial and lateral pectoral nerve, and through the PEC2 block we cover the lateral cutaneous nerve of the chest, of the spinal nerve of the T2 to T6. So now come to the anatomy that is relevant to the PEC1 and PEC2 block. Here you can see the pectoralis major muscle. It takes origin from the sternum and medial of the clavicle and gets insertion over the crest of the greater tubercle. When you remove the pectoralis major muscle, then you can see the pectoralis minor muscle. Pectoralis minor gets origin from the third, fourth and fifth rib and gets insertion over the coracoid process of the scapula. So now come to the serratus anterior muscle. So serratus anterior muscles divided into the superior, intermediate and inferior part, and it takes origin from the second to ninth rib and gets insertion over the scapula. So now come to the technique. So to perform the PEC1 and PEC2, patient should be placed in a supine position and arm should be abducted. So first you have to place the high frequency linear probe just below the lateral 1/3 of the clavicle here, and what you will see this image. So here this is a thick muscle that is the pectoralis major, and just below the pectoralis major you can see this is a pectoralis minor muscle, and here you can see a round with acoustic shadow that is the rib, and in between the rib you can see a shimmering structure that is the pleura. So next step is you have to move your probe in the oblique fashion, and you will see this sonoanatomy. So here this is a pectoralis major muscle, this is a pectoralis minor. Here you can see the serratus anterior muscle. So just below the serratus anterior muscle you can see the rib shadow, and in between the rib shadow there is a pleura. So if you deposit the drug between the pectoralis major and minor, that is known as a PEC1 block, and if you deposit the drug between the pectoralis minor and serratus anterior muscle, it is known as a PEC2 block. So first place the high frequency linear probe, keeping the orientation marker cranially just below the clavicle, and what you will see, you will see uh, you will see a thick muscle that is a pectoralis major, okay, and you can see a thin muscle, this is a pectoralis minor. So if we inject the drug in between the pectoralis major and minor, that is the PEC1 block, and now if I move my probe slightly toward the axilla, so you can see the serratus anterior muscle also. So here you can see this is a pectoralis major muscle, this is a pectoralis minor, and this is a serratus anterior muscle. Here you can see the rib with the acoustic shadow, and this is a pleura. So we are going to perform the PEC1 and PEC2 block with the single puncture. Here we are going to perform PEC2 block, and you can see that my needle is approaching between the pectoralis minor and serratus anterior muscle. Here I am going to deposit the drug. You can see the drug is going to unzipping the plane between the serratus anterior muscle and pectoralis minor muscle. So here I am going to deposit the 20 ml local anesthetic.